Watch what happens as this provider becomes more and more confrontational in her warnings about tobacco use and her advice to quit smoking.
Okay, so I wrote a prescription for an antibiotic for Aiden that should help with the ear infection, but in looking through the chart, I mean, it seems like he's had 6 or 7 of these just in the past year or so.
Yeah.
That's really a big problem.
Yeah, it's pretty stressful for both of us. I think it's really upset.
Well, one of the primary risk factors for multiple ear infections in kids is actually smoke exposure. Are you smoking?
Yeah, I do smoke, but I don't smoke around him. I try really hard not to smoke around him.
Well, the fact that he's having these ear infections is indicating to me that he is being exposed to smoke. And so what can you tell me about that?
I don't know. I mean, I try really hard not to smoke around him. I don't smoke in the car. When he's home, I go outside to smoke. I mean, I know it's bad, and I know it's bad for him, so I don't want him to be around it, so I try really hard.
I really need you to quit smoking, both for your health and for Aiden. Did you know smoking around your child is associated not only with ear infections, it could get to the point where you have to put tubes in his ears pretty shortly here, but also things like vitamin C deficiency, cavities. It's really putting him at a lot of risk. In addition to that, kids of smokers end up smoking themselves. Do you want him to grow up to be a smoker?
No, but I don't smoke. I've thought about quitting, but it's really hard, so I just don't know how to do it.
Well, now's the time to quit. It's really gotten to the point where you can't keep smoking. Not only for him, like I said, but also for you. You're putting yourself at risk for lung cancer, for emphysema, for oral cancers, for heart disease, for all kinds of things.
I know. I've heard. People have told me before. I've heard all that. I just don't know how to do it. How am I supposed to quit? It's so hard.
Well, there's all kinds of things you can use now. It's not as hard as it used to be. You can use nicotine replacement. There's patches, there's lozenges, there's gum, there's the inhaler, there's nasal spray. We can talk about medications. You can try Chantix, you can try Zyban. There's quit smoking groups you can go to. There's hotlines you can call.
I just don't have time
There's
for
no
any of
reason
that.
why you shouldn't be able to quit. This is really important.
I understand that. I know it is. I mean, everybody has problems, right? It's really, really hard.
Well, what can be more important to you than the health of your child?
I don't know.
I really need you to tell me that you're going to quit smoking. This is really important.
I'll go look at all those things and I'll find. I guess I'll try to find something and I'll talk to my doctor about it.
Okay, well, I think you really need to think about this seriously. Like I said, it's really putting yourself and your child in danger.
Okay. Whatever. Okay.
Okay.
Watch what happens this time when the provider cues in to what the parent is saying, empathizes with her situation, and attempts to work with the parent to find a solution that fits her needs.
Okay.
I did want to talk to you, though. I'm a little bit concerned looking through his chart at how many ear infections he's had recently, and I noticed that you had checked the box that someone's smoking in the home, so I was wondering if you can tell me a little more about that.
Well, it's just me and him, and I do smoke. I try really hard not to smoke around him, but I've been smoking for 10 years, except when I was pregnant with him. But it's so stressful being a single mom and having a full-time job, and so that's why I started smoking again.
You have a lot of things going on, and smoking's kind of a way to relax and de-stress.
Yes, yeah. Some people have a glass of wine, I have a cigarette.
Sure. And it sounds like you're trying not to smoke around him. Why did you make that decision?
I know it's not good for him. I mean, I've read those things about ear infections and asthma and stuff, but other kids have ear infections and their parents don't smoke.
So on the one hand, you're worried about how your smoking might be affecting him, and on the other hand, you're not so sure if it's really the smoking that's causing these problems.
Right, yeah. I mean, he doesn't have asthma. He hasn't had a lot of other problems that his other friends have. So, and I've thought about quitting before in the past, but I just don't see how it's possible right now.
What made you decide to quit smoking when you were pregnant?
Well, he was inside me, and we were sharing everything, and I knew that he would get some of that, and I just didn't think I could live with myself if something happened to him.
Right now, though, it feels almost too difficult to even manage or even to try.
Yeah, exactly.
How were you successful when you quit before?
I don't know. I think about it now. I don't even know how I did it. I just did it. You know, I just couldn't imagine like him not being born or going into labor early and him having problems and stuff like that. All the stuff that they talk about with women who smoke. So that was just enough to say, okay, you know what? I'm not going to risk that. So
the risks were so scary then that you were able to stop, but
Yeah.
they don't feel as scary to you now.
No, I mean, we're two separate people, and like I said, I try really hard not to smoke around him. I'm pretty good about that. I don't let other people smoke around him. So
You're doing the best you can do.
yes. Yeah.
Okay, but it sounds to me too like part of you really does want to quit.
Yeah, I know that I need to, and I keep, every new year I say, okay, this year I'm going to quit smoking, but then something happens and it just doesn't.
It's
and
on your
quitting
to-do
doesn't
list,
happen.
it's just not making it to the top.
Yeah.
If you did decide to quit, on a scale of 1 to 10, where 1 is not at all confident, you don't think you could do it, and 10 is you feel pretty certain that you could, where do you think you fall right now?
Probably like a 5. Kind of in the unsure area. Like, I know I've done it before, so I know I can do it, but at the same time, it just seems really hard, and it's
Sure.
not the same situation.
Well, what made you say 5 rather than 2 or 3?
I know all the ways it's bad for me, and I don't want him to grow up thinking that it's okay to smoke. I don't want him to use any kind of, I don't want him to chew or anything like that. So I know I need to, especially before he gets old enough to understand what mommy's doing, but I just don't know if I can do it.
Okay. So it sounds like you have a lot of reasons why you'd like to quit. You have been successful quitting in the past, and right now you're just feeling a little bit hesitant about your ability to do it.
Yeah.
Where do you think we should go from here?
I don't know. I'd like some help. I just don't know what kind of help I need.
Sure. Well, if you'd be interested, that's something I can definitely talk to you about. There are a lot of new options that can actually help people be way more successful in their attempt at quitting. I wonder if we could talk about some options that might fit into your life.
That would be really nice.
Okay. Well, if you're willing, then we could set up another appointment where you could come in and we could talk more about that.
I would like that. That would be great.
Great.
Thank you.
Sure.
This time, the provider had the same agenda: to talk to this parent about the dangers of secondhand smoke and to counsel her to quit smoking. However, this time the provider's focus was on the parent's own view of the issue. By giving the parent an opportunity to reflect on her situation, the provider was able to elicit reasons for change from the parent herself. There was no need to lecture or scold, because the parent was making her own case against smoking. Many times, our patients already have the information that we try to give them. What they really need is someone to listen to them and to help them sort out a plan that will fit in their life. By accepting and respecting our patients, even with their faults, we communicate our genuine desire to help them make positive changes in their lives. During this interaction, the provider demonstrated that she understood the parent's struggle and that she still wanted to help. As a result, this single parent found she finally had someone on her team. This increased both her interest and willingness to try working further with the provider to find a solution that would fit in her life.